All right, good afternoon, everybody. I believe we are now at 12 o'clock and we'll go ahead and get started with our webinar. I am Helen Hockey. I'm the Executive Director for the Pennsylvania Coalition for Oral Health, and we're really excited that you're joining us on this very cold Friday afternoon on your lunch hour. So we appreciate your time today. Welcome to all, whether this is your 10th PCOH update or your first. We're really happy you're here. We offer these brief updates on the coalition work twice a year, typically in the summer and then in December. And as always, this meeting will be recorded and shared on our YouTube channel. So you can share the link with others after today. And you can also view our older recordings there as well. So just a little bit of housekeeping as we get started. All lines are muted by us. We are in webinar format, so that'll keep our background noise to a minimum. You can use the Q&A box, which is down below on your Zoom banner there for any questions that you have. If you have any technical issues, feel free to chat us. We're happy to help if we can with those. And as far as questions, I may be able to grab a question or two as we're sort of going through the slides, but if not, I'll make sure we have some time at the end. So feel free to type in questions, and even some of our staff may be able to grab them throughout the presentation. So we're also going to be sending the link out for the presentation directly to everyone who's registered for today, as well as the slides by themselves as a PDF. So many of the slides have clickable links, active links that are built into them. So if we mention a resource or something, you'll be able to go right to it from that PDF of the slides. So with that, we will go ahead and get started and share a little bit of information with you all today. So wanted to start by saying here's our PCOH team. I know that many of you have worked with us in the past on some of our collaborations, and wanted to update everyone that Allison has completed her 2-year term with us as a public health associate through the CDC. And now she's started a permanent position in the Baltimore area with the Health Resources and Services Administration, or HRSA. So we wish her the best of luck. And I know that she's going to continue to advocate for good oral health in any position that she takes on. And I also just wanted to say a quick thank you to our entire team for all of the hard work. Everybody has really put in a lot of work this year, and we've been able to grow the organization and our reach pretty significantly, which we're going to talk about. So that's wonderful. And now I would like to ask our board chair, Dr. Joan Gletch, to go ahead and say hello. We're very fortunate to have Dr. Gletch here with us today to be able to offer some words. So, Dr. Gletch, are you able to join us there?
I am. My video's working. I cannot start. My audio's working. And here's starting my video. Hi, everybody. So glad to see so many people have signed up to hear the update of the many wonderful 2024 activities that the Pennsylvania Coalition for Oral Health has completed. What a dynamic organization. And I think you'll see from the presentation today that there are multiple activities that help move the mission forward, especially in advocating for oral health for all in Pennsylvania. So first I want to thank our fabulous team. Helen Hawkey has assembled, Helen as executive director, has assembled a very passionate, active group which is growing. You'll hear more information about the additional staff we'll be able to bring on. But kudos to Helen and each of her staff members for their great work. And thanks for our longstanding stakeholders. Without you, we cannot achieve all our activities. It's stakeholder engagement that's so important to us. So stay tuned. Next year, we'll have both the 6 months, both the summer and then the winter updates. But next year also is a year that will have our wonderful meetings we have every 2 years. The summit will occur in November. So I'll end with my introductions, but on the page that you're viewing now, you see our very committed board members. We're going to be bringing in 2 new board members beginning in January, and anyone who's interested, let us know. We have lots of committees you can join. Certainly, there'll be lots of work to do in planning the summit, but you may consider applying as a board member. So we welcome widespread participation and collaboration. We're glad you're here. Thank you. Back to you, Helen.
All right. Thank you so much, Dr. Gletch. So, as the year draws to a close, I do want to say, a very special thank you to our board of directors. They each provide a lot of time and leadership to our work, and so we're pretty proud of the investment that they make in PCOH. So thank you all so much. Just a wonderful group to work with. So for many of you, of course, this isn't your first interaction with PCOH, but we do have some new stakeholders on the call. So just wanted to remind everyone of our coalition priorities. When we talk about sort of the main areas that we focus in, we see workforce kind of rise to the top, policy, water fluoridation, and then, specifically looking at the equitable access for our most vulnerable populations. So those are sort of the 4 groups that we work in. We're going to talk a little bit more about that today. I do want to point out that it is just a very quick 1-hour call, so we can't talk about everything that's going on, but we welcome everyone to reach out after today's call to talk with us a little bit more about some of the things that we're working with and how you can be involved. So all of our work is really collaborative, and we frequently work with other organizations around the state to accomplish our mission. So that's one of the reasons that we host these calls, and we want to make sure everyone knows the most recent updates for the work that's going on. So if you hear about something today that interests you, let us know. We'd love your help. And that can also include just sharing resources, checking in with staff members, or as Dr. Gletch mentioned, joining a work group or a task force. So if you need help from us, please let us know. We love to work together with people. So again, just our main focus areas that we're going to talk about today, and tell you a little bit more about some of the challenges we're facing. So we don't always talk about our challenges, but I wanted to spend some time today really kind of going over, where those challenges lie, and hopefully to ask for your help with some of them. So I'd kind of like to think that everyone who's joined us today can now pick a New Year's resolution that's around oral health. So I'm going to give you guys a couple things to choose from, and we'll see if everybody can prioritize that in their New Year's resolutions. So that's your task. So one of the main reasons that PCOH was started more than 10 years ago, as a loose coalition, was to advocate for water fluoridation in all communities in Pennsylvania. So at a time when we focus on equity and getting people the resources that they need to live their best lives, community water fluoridation is really the most important population health measure that we can incorporate for good oral health. And fluoridation is a practice that's been used in our country for nearly 80 years. So that's right. We've got January 25th at 4 p.m. Mark your calendars. Fluoridation will celebrate its 80th birthday. So that's a big deal. There are thousands of studies on its effectiveness. In fact, it's one of the most heavily researched health interventions. Every major public health and medical organization, all support the benefits and safety in preventing tooth decay. And one of the reasons that water fluoridation is still so effective is that it reaches everyone in a community. So regardless of income, insurance, ability to access care, you can be reached and your health can be improved by water fluoridation. So we've got many just kind of pretty cool discoveries over the last 50 years or so in things like fluoridated toothpaste, preventive dentistry, but those things don't always reach everyone. And so we really feel like water fluoridation is the most equitable way to reach an entire population of individuals and families. So how could we not start with challenges to community water fluoridation today? The past 2 months have been about the most media active within the space of fluoridated water that I've ever seen. It started back in August. There was a pretty highly anticipated monograph from the Department of Health and Human Services and their National Toxicology Program that was released. The August report found that drinking water at more than twice the recommended limit, so that's very important to point out, more than twice the recommended limit was associated with lower IQ in children. So I'm saying that is what they said. The report notes that those findings are limited to fluoride exposures that are more than 1.5 milligrams per liter, which again is twice what the Centers for Disease Control and Prevention recommend at 0.7 parts per million for water fluoridation. So that was sort of the first issue that we had. We ran into that. I will say I was actually, when that report, kind of came out, it was something that we knew was coming, but we want to make sure that everyone understands it's not talking about causation, it's talking about an association, and it's talking about levels that have nothing to do with what we use for water fluoridation. But then in response to that, a judge in California in September has actually ordered the EPA at the US government level to initiate a proceeding under the Toxic Substances Control Act. So there was a citizen petition from fluoride opponents that was presented to the EPA and denied. And so then that sparked this court case, right? So that's where we're sort of sitting. But in a footnote for that court case, the court actually left the door open that the EPA could conduct an additional analysis or seek additional information to put a finer point on that risk before they take any regulatory action. So that court case, even though it made a lot of news when you actually read and learned the details, it really remained very unclear as to what EPA actually has to do right now. They could set up what they call a deliberative evaluation process, which means that they could spend a few years getting stakeholder input and then make some kind of decision or ruling. That's sort of what we think might happen, is that they could just kind of continue the conversation. But we don't really feel like we're going to see a policy or anything come down right away. So that's sort of where we're sitting with that EPA court case. And then next, so here we are, August, September. Let's throw in the end of October, beginning of November. We had the media blast that, our now President-elect Trump, his nominee for HHS secretary, has had multiple occurrences of anti-fluoride sentiments. So regardless of any actual intentions and practicality of the federal government trying to deal with fluoride, the media and the headlines have really proven to be detrimental to our fight when we're talking about retaining the adjustment of fluoride in drinking water. So I wanted to share the words of my counterpart in Kansas, the executive director of Oral Health Kansas, Ms. Tanya Dorf-Bruner. Her quote, which I thought is just really important, what she had said was, the opponents to fluoride have been emboldened by this rhetoric. Their view has been validated, and so now our battles will begin regardless of what actually happens in DC. So the damage has been done. Because of all the media buy-in, it's just really made a mess of water fluoridation. So we have seen this already affect items and situations in Pennsylvania. So a community that we had been working with for months to educate on the importance of retaining fluoridation, going to different meetings. They held a vote on November 20th. So again, timeline-wise, right where we're at. And so this is Clearfield Municipal Authority that we're talking about, sort of in the northwest corner of the state. They voted to discontinue their fluoridation program during all of this media attention. And in the follow-up article the next day in the paper, the chairman of the board was actually quoted as saying that the decision about treating drinking water with fluoride may not be the authorities much longer. We may not have a choice. We may not know for months or years, but the state may decide to remove it. It looks like we're moving in that direction. So here again, just the headlines have now caused a problem where people are sort of believing those things. So Hand in hand with all of those challenges is the fact that we still have some pretty, what we'd like to call quiet champions. We have so many advocates and supporters of fluoride in our state, but for many years, everyone's kind of stayed quiet. You know, don't talk about it. We don't want to have to defend it, like just kind of keep it quiet. And I would say now that we are challenged, and now that we have been challenged, we have to start talking about it. So it's definitely time to be more proactive. Start talking to your communities and water systems about how important water fluoridation is. So how we're working on that, you know, we've talked a lot about this. You guys have heard us talk about water fluoridation for years. So I'm not going to, you know, revisit all of that, but I want to focus on a few things that have kind of risen to the top lately. So with our recent attention, you know, that's been coming through, we've been getting a lot of website and fluoride map hits. Our fluoridation map, which is on our website, shows you if your home address or work address is fluoridated. In October, so prior to all of the big media buzz, we were getting about 7 views per day. In November, we were getting almost 100 views per day. So that's a huge increase in the amount of people going to see if their water's fluoridated on our map. And then likewise, we have a web page that's dedicated solely to fluoride. And we saw 3 times as many fluoride page views in November as compared to October. So we know people are looking, we know people are talking about it. So we've got to make sure that, you know, we've put out some statements and some new documents to help people with the conversation. We want to make sure that everyone feels comfortable in this space. So lastly, we continue to attend water system conferences. We want to talk to the actual decision makers and the water operators who are working in it every day. So the CDC recognizes water systems who are able to consistently keep their fluoride levels at optimal level. And until now in Pennsylvania, we have not been able to participate in those awards because our state does not require monthly submissions of fluoride level. So through the state's new 3-year award from the CDC, we're going to now be requesting those data, and we hope to turn that into recognition for our water systems that are helping their communities. So we'll be doing hopefully some water quality awards in the next year, and we're also going to continue to award water fluoridation grants for equipment upgrades. So if you have a water system that is interested in initiating fluoridation, or, you know, needs new equipment, those are options that are available as well. So just a little bit of additional information on where we're focusing our work. And so now, time for New Year's resolutions. How can you help? Number one, I just want to say be loud, right? And we've just got to start sharing the message, talking about water fluoridation, encouraging people to understand the science behind it and how important it is. There have been some situations, and for those of you who are dental providers or healthcare providers, you're probably seeing even where sort of our own people are starting to questions and doubts. I've seen on social media where, you know, even dental hygienists are starting to question fluoride. So we want to make sure that everyone's really looking at the science and where it comes from, and to fully understand that some of those messages are being misinterpreted. So if you can share some of those resources and those materials, that's great. If you want to be an even more proactive, you know, member of the team, we have a task force. There's going to be a link on the slides that comes out. You can join our task force for water fluoridation. We use our task force to share messages and also to make sure that, you know, for the folks who are, you know, in a community, so like Clearfield, which, you know, thankfully we were lucky that our own Nicole here at PCOH lives in Clearfield. She was able to attend all the meetings and talk with them. But we really need someone who's a strong advocate in a community to be able to go to some of those meetings when the problems arise. So just something to think about if that sounds like something you'd be passionate about. We are definitely looking for help there. So the next subject I want to do a quick update on is our Medicaid advocacy work. With about 3 million people in Pennsylvania relying on Medicaid for their health care, it's pretty important that we have adequate access to dental care and dental providers. As many of you know, back in 2011, due to some state budget cuts, We changed the adult program of dental benefits and essentially removed access to things like root canals, gum disease treatment, and crowns from like the list of available procedures. So on paper, those services are still listed as covered, but there's a more complicated approval system in place that really doesn't work for about 90% of those who apply. So in addition to, those slightly reduced benefits on the adult space, we also have a shortage of providers right now willing to accept Medicaid. So that's left a lot of kids and adults without any dental care at all. So when we talk about that lack of access, we are talking more about what's called network adequacy. Our state requires that insurance companies and health plans must have a sufficient provider network to see people that are enrolled in their plan. So you can't, provide insurance, but then not have healthcare providers who are willing to do the treatments. But with wait times at nearly 2 months for an appointment in Pennsylvania, we are definitely not meeting the requirements. So typically when we start talking about this as a challenge, the normal solutions will start with one of two things. We either have to add providers by paying them more or make the process easier to enroll and navigate for our providers. So I would say the bigger challenge of those two this year has been the payment model. We've been fortunate that our state did put in a budget increase for Medicaid dental care. And there's a link there on the top left, so you can check that out. There was some heavy advocacy done to add an increase in a fee schedule. This will affect it's 31 dental codes that will get an increase. And I just heard this morning, and so don't quote me on this, but I just heard that it's a 27% increase over the previous rates that will take place in January. So that's where we're kind of looking at for those 31 codes, which is great, but I have it listed on the challenge page because I will say that the codes were not necessarily skewed for adult care. There was a lot of coverage for pediatric procedures, which is wonderful for getting care to our kids, but maybe hasn't prioritized the adults as much. So that is something that remains a challenge, especially with a reduced adult benefit. Our reimbursement still remains low. So using our 2024 numbers, so not talking about that increase, the American Dental Association and the Health Policy Institute just put out a new map and chart just in the last week or two that really talked about what is the percentage that we pay in our state Medicaid plan as a percentage of what dentists actually charge. And so when we look at Pennsylvania, and again, you'll be able to go right to that map via the link, we're paying about 28 cents on the dollar for adults getting Medicaid care as compared to what dentists are actually charging. So again, even though, we know rate increases won't fix everything, we do know that they do help recruit new providers and help retain providers. So in a situation where, and we'll talk about workforce, where we don't have enough providers to go around to begin with, anything that sort of jumps up as a barrier is going to cause more problems. So, and then of course, we're also looking at any changes that could happen with a new administration, what changes could be trickling down into the Medicaid space. So those are sort of the main pieces of our challenges that we're looking at. So then what we've been working on in our recent work in this space, I obviously mentioned those cuts back from 2011. The restoration of those full comprehensive benefits is a top priority for PCOH. We've been pursuing this in a variety of ways, of course, including legislative advocacy. So for those who aren't as familiar, our state runs on a 2-year legislative session. So the current one we're in right now was all of 2023, all of 2024. So that means that a bill, once it's been introduced, has until the end of that session to pass and become a law. The bills that we worked with, these legislators in the last session to introduce House Bill 1417 and Senate Bill 955, which would restore the adult dental benefit. They got a lot of attention during this session. And the House bill even passed through the House and was sent on to the Senate, but unfortunately didn't make any progress there. So these bills are essentially dead now because our session is about over. And they will then need reintroduced for our next 2-year session, which will start in January. So, that's something we're going to continue to work through. And we'll talk a little bit about how you can support that on the next slide. I briefly wanted to just mention that we continue to work with the American Dental Association, and they have a pilot project with 6 states that is really focused on increasing the number of Medicaid providers that there are in states. So we have some predetermined goals of increasing those numbers. And we're, of course, working on getting information out. We've gotten some advertisements, flyers, social media posts, etc. And I think, I do want to point out that our Department of Human Services has worked really, really hard over the last year or so to add new fees and increase preventive services that are covered by Medicaid. So there's a few fees now that are even covering services that private insurance doesn't cover. So one of the items that we have to work on is making sure dental providers are aware of this. And that they understand that even in certain situations, they could get paid more by Medicaid than they get paid through commercial insurances. So we've got a number of documents out there to kind of share that information. And then the last thing I wanted to bring up was, we have also been sort of reaffirming. Many of you know that back in 2017, our state allowed our direct access hygienists, our public health hygienists, to be able to be credentialed through managed care organizations and to see Medicaid patients. And we were able to confirm that that also includes CHIP enrollment. So for our public health hygienists out there, they could be credentialed with the CHIP programs. And we feel like we're probably going to have to do some work around the pieces of how do the CHIP programs know that? Are they working in this space? Are they making sure that they're working with the public health hygienists? So I see that being a bigger issue coming into 2025. And then the last thing I just wanted to mention, you may have seen some of the news about it, is that our state did ask under the health program to add continuous eligibility for kids under 6. So that means that once a child under 6 has been enrolled in Medicaid, they don't need to go through that crazy and re-enrollment process all the time, that they can have continuous eligibility up through age 6. So what that does, and what's amazing about that is actually helping to address the burden of provider paperwork and provider admin. So you don't have to worry so much about making those verification calls and making sure that someone's covered by insurance when you're seeing them, particularly for that population. So how can you help? Number one, just if you're a dental provider, why don't you take Medicaid? That would help a lot. That's the easy way to do it. But I know that's tough sometimes. But we want to make sure that dentists and public health hygienists are enrolling, even if you choose to see limited numbers. So even if you're, looking at that and you're saying, hey, I'd like to at least just see 5 families or 10 families in my community, it does help. And if everyone would do that, we'd be in pretty good shape. So if you're not a provider, but you know providers who aren't participating, maybe even your own provider, ask why. Ask why, ask them just to help a little bit. Because it really is going to take a pretty big increase in numbers to address some of these access issues. So you can share our Medicaid documents. They're all available on the website. We've got things linked there. And then in terms of the legislative piece, there was, both of the sponsors, both with the Senate bill and the House bill, that were introduced to get the benefits back in Medicaid. Both of those prime sponsors have already expressed interest. Some of you may have seen that Senator Costa already circulated a co-sponsorship memo saying that he intends to bring his bill back, which makes us very happy. And we're having lots of conversations on the House side as well. It is definitely their intention to bring the bill back in the House. So with that being said, starting in January, when these bills get introduced, we could use everybody on this call to talk with their local legislators and to get them to understand the importance of supporting this bill. So we're happy to do that, happy to sit with you, take a meeting with you, any of that, to sort of make sure that we get this across the finish line. And then the last thing, in terms of every time we do a presentation and we talk about issues with Medicaid, where we come into this is, oh, well, we tried to get credentialed and it took 6 months and nothing ever happened and it didn't work. And well, unfortunately, complaining, and I'm going to say complaining to the insurance company about the insurance company isn't always the best way to go about it. So when you're having challenges with credentialing and paperwork, often we're able to share that directly with DHS. You can share it with DHS. And let's make sure that we get those challenges addressed. Because that's the only way we fix a problem is if we talk about it and we find a solution. So definitely when you're having those challenges, don't just sit there and curse at your computer. Let us know, see if we can do anything to kind of help you with that in that space. So the next thing I want to touch on is workforce. So we talked a little bit about the Medicaid space, but also now, we can't get too far without talking about the overall workforce and what that looks like in terms of care. So when we look at our challenges in workforce, and I think many of you have attended some of our past workforce sessions, some of the details. But in our state, we need about 300 dental providers to address just the bare minimum in our shortage areas. So if you think about that and you realize that we only graduate about that many dentists every year, and the majority of those students as they graduate go to practice in urban areas or other states. So one of our previous workforce reports highlights some of those issues. I have it linked at the bottom here. You can probably just barely make those charts out, but hopefully you can blow them up on the big screen when you get the slides afterwards. The numbers that we reported back last year in our report was that about 20 out of all of our Pennsylvania schools graduating dentists, only about 20 of those graduates are choosing to practice in the dental health professional shortage areas. So if we need 300, but we're only getting 20 a year, we're in trouble. So another challenge is that we need to get more Pennsylvania students to apply to dental school. All of our dental schools are really doing their best to enroll as many Pennsylvania residents as they can. But what we're finding is they're not getting as many in-state applicants when we talk about ratios and how that looks. So, that means that if we want to get more dentists practicing in Pennsylvania, we've got to talk to kids all the way back to high school and, post-secondary to really get them to understand that dentistry could be a career for them. So we'll talk a little bit about that. But, and then, so talking about, the workforce coming in, now let's think about our existing workforce and the challenges that we have there. I mentioned about the rural disparities. When we look at the dentists that are practicing in urban areas, they typically outpace our rural dentists 15-1, even when we adjust for population density. So you've got a lot more dentists practicing in the urban areas of the state and very few in the rural areas. So to make that even worse, when we look at the most recent numbers we have, which were from a 2021 licensure survey of dentists, it was approximately 32% of the dentists that are currently providing patient care that said that they're going to be retiring in the next 5 years. So that's bad. And when we look at dental hygienists, it was 28% are planning to retire in the next 5 years. So we're expecting that our shortages are going to get worse across the board. We are also struggling to dental assistants as well. So we've got to start thinking a little more creatively about how we're going to fix some of this stuff. So our work in this area, starting with that dental assisting, we understand that dentists can work faster and see more patients when they have support. and they need more assistants. They need more expanded function dental assistants. They need more dental hygienists. So, we're looking at ways that we can do small projects that will help. Our DART project, which is a brand new program, dental assistant radiology training, was basically an answer to some folks that reached out and said they were really having trouble getting their on-the-job trained dental assistants to pass the radiology exam that's required for dental assistants to take x-rays. So that program is right now, we just started it. It's accepting enrollment. And I know Amy just threw the link in the chat. And you'll have it on the slides as well. But that is a program that if you have an on-the-job trained assistant, or even one that went through a program but has struggled to pass the radiology training, we are going to be offering a live 20-hour training with a certified dental assisting instructor to try to help in the situation. So it may only be that we get a handful of these folks through the training every year, but every little bit helps, and we're trying really hard to be creative in how we handle these things. So we do have a community of practice group that meets to talk about workforce on a monthly basis. They are working on our pipeline plan, which we've got to try to, as I mentioned, build up the people that are interested in these dental careers. And that goes hand in hand with our Speakers Bureau. So I think it was a year or so ago, we started asking, and some of you I know are even on this list, like, hey, if you're a dental professional, would you be interested in joining our Speakers Bureau? So that we have started to get requests from high schools and school districts, hey, could you come in for half an hour and just talk about dental careers? We've got materials, printed materials available, activities, PowerPoints, all of those things. But what we need is the people to actually go in and talk to the students. So if that's something that interests you, we're hoping to be able to utilize it more this year. We've been able to do a handful, a half dozen or so this past year. And we want to make sure we're doing as many of those presentations as we can. So, and then lastly, sort of where our work is centering around in this space, we continue to do our HRSA programming, which means that we're working with expanding our community health workers that feel comfortable educating their clients on oral health. We were able to add a second community health worker training course to our free webinars that are on our website. And we continue to work with those programs that certify and train community health workers. And so I think that that's a great place for, in terms of doing patient education and how to navigate to dental care, our community health workers are going to be vital in this area where we've got less providers available. And then our Dirty Teeth book project is where we work with dental students and dental hygiene students across the state to talk about public health careers, and then more specifically the population of older Pennsylvanians that don't always have equitable access to dental care, and sort of what we can do in that space. So we've been pretty successful with that program, and we've trained, hundreds of students in that space. So we're hoping to continue that. The HRSA grant will be running through 2026. So we'll have some time to continue that program. So what can you do? And I wanted to point out, that when we talk about how do we, it's almost like we need to stretch the dental system right now. So it's really, really impossible, I would say, to make a dentist, right? So if you want to make a dentist, that takes about 10 years. Okay. So from the time you decide I'm going to make this person into a dentist till the time they're a dentist is a 10-year process. We don't have 10 years. So what we really got to look at is how can we make sure that people have access to dental care, quality dental care, in a way that, kind of doesn't cause issues, which means that we've got to stop disease faster. We can't let disease progress to the point that people need, really lengthy, crazy care. And so one of the things that we've, been rumbling and talking a lot about is how we get more providers to really look at minimally invasive care. So the ADA, published a few pretty cool guides back in 2018 talking about, treating cavities, without so much drilling and filling, looking at the medicines that we have available now to treat cavities. And so we'd love to see, more providers taking that up. We want to see more age 1 dental visits. We want to see more education happening at that level. Our 2021 licensure survey report that the state does, it was pretty telling in that about half of our dentists in the state, our practicing dentists, will not see a child before age 3. We can't have that because by age 3, they already need costly care. So we've got to start seeing these kids a little bit earlier. For those of you who know me, this is my soapbox and the hill I will die on. But we want to make sure that we're getting kids into care quickly. So if you'd like to do more on the career side and you feel like your space would be, talking with students about your career and what dental careers look like, we would love for you to join our Speakers Bureau. There's always room for that, and we've got lots and lots of counties to cover in the state. So we would love to be able to share that as an option for more high schools and school districts. And then the last thing I just wanted to touch on was, integrated care. And when I say that, I'm talking about ways that we can see oral health assessments and screenings being done across the board. It also could mean services like silver diamine fluoride being offered in the medical office. We've got to try to do dental everywhere now. And that's going to be really, really important for moving forward and making sure that no one gets left behind as these provider shortages kind of work themselves out. So that's just a little bit of information on the workforce side. The one thing that we don't always talk about, but I wanted to mention today, was our school health work, because that's something that's been kind of goes hand in hand, right, with the shortage of Medicaid providers, the shortage of workforce, community water fluoridation advocacy, caries prevention. All of that really does tie together into school health. And so it's kind of risen again to the top of something we've got to start talking about. So in our state, we have a few challenges in the school health space. And, some of you are aware of those things. But, one of the top things is that we have health programs and health services sometimes being offered in schools, but without reimbursement. So in our state, we've got certified school dental hygienists and dental hygiene services programs where they're able to offer care, clinical care to kids right in the place they go every day, but no way to really track that information or reimburse for it. So our state did receive a federal grant to look into that, but it wasn't primarily focused on dental care. So we are hoping that the outcomes from that grant, that we could actually fold dental into that. So something that we're keeping an eye on, but it could be a challenge in the future. We also have seen a number of school districts that, aren't doing necessarily the fluoride tablets or the fluoride supplementation programs anymore. The new school health procedures revised guidelines for school dental health programs do have information about varnish programs in there. So if we can get more schools to be doing fluoride varnish, that could be super beneficial. And then again, I mentioned our school districts that have certified school dental hygienists. That's an employee of the school district who has an educational specialist certificate and works directly at the school every day. Out of our 500 districts in the state, only 26 of them have an approved dental hygiene services program this year. So, personally, I think we could benefit from having more of those programs so that we can get more access to more kids. And then I know a lot of you have heard about the basic screening survey and, the data that we were able to discover implementing that a few years back. We know that 60% of third graders in the state have cavities, and most states do those basic screening surveys every 5 years. So our first one was in 2021. And so we really do need to locate and prioritize funding to keep doing those surveys. They're not that costly in the scheme of things, and they're the only way that we get real data on what's happening with our school age kids. So very, very important and a challenge to this day and point, we have not been able to figure out what we're going to do in 2026, but we do need to start planning in 2025. So definitely a big challenge. So where we've been focusing on, some of you have heard we were able to secure funding through the CareQuest Institute for Oral Health to work on a year-long project with the end result of having a final report to look at the issues with school health, what's going on in the dental space, and hopefully to make some policy recommendations of ways that we can pursue change that will help. So that will all be coming out in 2025, so stay tuned. And some of that work is focused around talking to school nurses. So we were able to do some surveys, complete some focus groups. And now we're going to be doing a pilot study in a few school districts around the state that will be assessing how many problems the school nurses are seeing. So I will share, even though it hasn't been published yet, about 3/4 of our school nurses are reporting that kids are making repeat visits to the nurse's office for dental issues. So it's a problem. We know it's an issue, and we want to try to address that. So that goes hand in hand with the Medicaid advocacy and how we pay for services, promoting fluoride varnish, as I already mentioned, and then hopefully increasing the number of our certified school dental hygienist programs. So how can you help? Check in with your local schools, see what they're doing, talk to your nurses, share our materials. Let's make sure that they know. Earlier this year, Act 55 passed, and we now have the ability that our public health dental hygienists can complete the mandated screenings in schools as long as that school district doesn't have a certified school dental hygienist. And so that's something that if your school district's struggling to find a provider to do those screenings, something to keep in mind. And then talk to them. We also help the Department of Health Oral Health Program with their school sealant programs. So if you have a school district that might be interested in a school sealant program, maybe we can make a connection. So those are ways that you can help in that space. So as we wrap up our last few slides, I mentioned earlier that, the connections and the collaboration that we do with our partners is a really big part of our work. We've got PCOH has a strategic plan that we follow. We also work very closely with the Department of Health and the state oral health plan, which has a lot of great 10-year goals that we're focusing on. But overall, it really comes down to partnerships and sharing the importance of oral health. So when we look at the outreach that we've done over this year, we've exhibited at a lot of events, meaning sharing our materials and all of the educational stuff that we have. And we've done 43 presentations, which is a lot. So over 2,000 people have gotten to hear us talk about oral health in Pennsylvania, which is pretty exciting. So really thankful for a great team that is able to kind of go around and do all this stuff and really share the information. So, and it always leads to more partnerships. That's the end result there. And then our new report, we do annual surveys of all of our free and charitable clinics. So this information is now on our website. These are our survey results from 2023. Because we know, obviously, we're tracking the care that's provided in the Medicaid system. We know some overall state numbers from some state programs, but this is, to our knowledge, the only way that we really know how much dental care is being provided in our state through free and charitable clinics. So just in 2023, more than 10,000 people had care given at a free clinic. So over $5 million in services provided. So we do that report every year. So something to check out if you're interested in sort of engaging with us in that space. And then, Amy, who handles all of our communications, does a really great job with compiling this information. We've got a lot of people we are talking to around our great state. So I did want to point out, we've seen a lot of increases in this. We have a clearinghouse available on our site where you can download documents and resources. You can request printed materials. And we have a lot of people that are taking care of, engaging with that. So 18,000 unique website users. That is a lot. 18,000 people coming to our website and looking for materials and resources. So really, really excited to see this. And thank you all for all that you do to share this information. It's helped us in so many ways. And then, of course, I have to like toot our horn just a little bit. We were really fortunate this year to be honored by the Highmark Foundation and their Breakthrough Futures Awards, that PCOH was recognized as a rising star, which we were able to attend a wonderful award ceremony, and that's Nicole there accepting our award, which really felt good. It felt nice to see that what we're doing matters and is being recognized. And then one other pending project I just wanted to mention, and I know Dr. Gletch alluded to this a little bit, is that, we were awarded 2 grants just in the last couple weeks that will be focusing on workforce in Pennsylvania in 2025. So the Appalachian Regional Commission and the McElhatton Foundation out of Pittsburgh have both pledged to support a program which will allow us to hire a part-time consultant for workforce. And we're hoping that that person will be starting hopefully very, very soon, and allow us to really address that dental assisting shortage, and looking at an analysis of where we're at with our dental assisting training programs, specifically focusing in the rural areas of the state, and the programs that are offered through career and technical education, like VOTEC programs. So really, really excited about that work that's coming down the line. And I do want to challenge you today to really start thinking about 2025. We've got our summit that happens every other year. We really need to think about, what kind of change we want to see in the world. One of my favorite quotes there: every system is perfectly designed to get the results it gets. Right? So if we want different results, we have to change the system. Our 2025 Oral Health Summit will be taking place in November in Harrisburg, November 12th and 13th. Mark your calendars now. We want to see you there. And I think we're going to be seeing a lot of focus and discussion around systems change at that event. So something to keep in mind. And if you're not following us on socials, please do. We do our weekly newsletter, which I know many of you get, but we also post a lot of information on social media that can also kind of help in the work that you're doing. So want to leave that there. A couple dates that are coming up, things to keep in mind. We've been doing sort of a loose workforce webinar series over the last, 8 months, 10 months or so. We were able to host one on loan repayment programs. We were able to host one on interstate compacts, licensure compacts. And we're going to be focusing more on that high school dental assisting career pipeline piece. So that will be taking place in January. It's a webinar, January 31st. So easy to pop in and join. And then we'll do of course, our next mid-year webinar update in June, and the summit that I already mentioned. So those are sort of the next 3 big outstanding dates that if you're one of our partners and stakeholders and you want to learn more and be involved, that's a great place to be. And then I kind of did this backwards today because I've talked to you a lot about the super high level of our work, kind of everything that we've been sort of prioritizing in the space. But I have to say, we have to recognize that we get so much support, in addition to some of our grants from our corporate and community funders. So how we do all of this work is as a nonprofit charity, and about 85% of all of our funds raised last year go directly into programs. Okay, so some of that's provided through our partners and subcontractors, but we have some dollars to be using there in those federal and community grant spaces, but we also have to rely heavily on the corporate partners and organizational partners and even our individual funders to keep us moving on a variety of these projects. So I just wanted to say, we appreciate you. Many of you have probably gotten our annual appeal letter this year. So I know we have a lot of our individual donors on the call today, and I just honestly wanted to say from the bottom of my heart, just thank you so much. You have no idea how much freedom that gives us in order to pursue some of these programs and these projects. And we can't do what we do without the dollars that you guys are able to share with us. So just want to thank you. It very much matters, you know, and if it's something that you haven't been able to do, but you're like, wait, it's the end of the year, it's time to donate to charity. Personally, I think PCOH is a great one. So definitely happy to help if you need any assistance on that. But, you know, just again, a final thank you to all of the partners here. So I do want to allow just a couple minutes for questions. I know we had some comments in the chat. So if anyone has any questions they want to throw into the Q&A. And I know, thank you, Dr. Kimball. I have not looked at frameworks yet for the water fluoridation. So I would like to kind of check into that. And then let me see here. I know, thank you. We did have the co-sponsor memo we talked a little bit about. Just double checking through here. And that's good. Thank you. Dr. Kimball also shared some information about talking to insurers for covering fluoride varnish. Very, very interesting. In our state, our Medicaid program will cover fluoride varnish in the Medicaid space up to 6 times on the medical side. So we definitely want to see private insurances going that way as well. So very good. Thank you, Dr. Kimball, for always being a great advocate for that. And then Dr. Z, I will send around. Of course, I cannot remember the 6 states that the ADA is working with for the pilot project off the top of my head. But I will share that information. I'll send that to you, Dr. Z. And also, if anyone else needs that, please just let us know. We may be able to find a link to send it out with the notes afterwards. So appreciate that. Any other questions? Yeah, and it's 6 times for medical, Dr. Kimball, on the Medicaid space. So a child that actually is enrolled in Medicaid can now have up to 12 fluoride varnishes a year if they're getting 6 on the dental side and 6 on the medical side. So, and up to age 21, which is a great point to make, because we've got to do as much preventive as we can there. Dr. Burkhart, thank you. Those 6 states for the ADA pilot project: Maryland, Nebraska, Ohio, Rhode Island, South Dakota, and Pennsylvania. Thank you, thank you, thank you. Appreciate the assist. So, okay, I'm just going to give it one more minute to see if we have any other questions coming in. Okay, Deb, one more question talking about Curodont. I will say that we haven't gotten any answers, or we haven't really seen yet, because the code for Curodont was just added in the last few months. We haven't seen utilization numbers yet, so we don't know if it's actually being used. For those that might not be aware, Curodont is a remineralization product that can help stop cavities when they're very early and they're just demineralized enamel. And so the Medicaid fee schedule did add that code, which is D2991. But we have not checked into whether it's being utilized yet, because it's, again, very new. There have definitely been a lot of conversations around it. So I think we'll probably need another 6 months before we can know yet if it's really being picked up. So, okay. And I'm not seeing any other questions coming in. So I think with that, I would just say thank you all so much for listening today. Please reach out. We will definitely be looking forward to working with everyone in 2025, and really just can't do it without you. So thanks for being a part of this solution that we are trying to implement in the state. All right. Thanks, everybody.